Guys, what's up? Today we are going to talk about a very interesting topic, which is chemotherapeutic drugs of intestinal protozoans. So in the coming slides we are going to talk about the protozoal parasites which infect humans and animals and how they can be treated through different drugs. So the first protozoan, which is Giardia lambda, which is a protozoan flagellate or an infective or causative agent or organisms organism of giardiasis. So giardiasis is actually a disease which is caused by a flagellated protozoan, which is Giardia lambda. So generally this Giardia lambda inhibits the digestive tract of a large varieties of organism, large varieties of domestics and wild animals as well as humans. So this Giardia lambda generally infect the cells of small intestine in the region of duodenum and jejunum, and it blocks the nutrient absorptions in the small intestine. So coming to the pathogenicity, so generally this Giardia lambda, when infected to a human, when it causes giardiasis to an organism or a human or animal, it generally disrupts the intestinal function in the small intestine, which generally leads to the malabsorption of fats in the duodenum and jejunum of the small intestine. So the consequence is the persistent looseness of bowels and mild sternoharia happens, and the patients will show the symptoms such as fever, anemia, and allergic manifestation, and many other symptoms. So generally the life cycle of these flagellated protozoans, which is Giardia lambda, is from a contamination of water, food, and hence with an infectious cyst. If there is an infectious cyst contaminated in all those things, the cyst generally ingested by a human or an animal through food or through this water, so it leads to, it generally cause the infection in small intestine. So the cyst generally converted into trophozoites, and these trophozoites giardia get mature and multiply in the gut, in the small intestine region. So it multiplies and make number of different copies. So through stools the infectious cyst and the trophozoite pass outside through the stool from the body. So generally these trophozoites do not cause infection because it do not sustain in the outer environment. The cyst, infectious cyst, which remain alive, and it again infected the water, the food and the soil, and generally again is a cycle which ingested by human or animals. So these are some drugs of choice for giardia. These are the some drugs of choice for the giardiasis, such as metronidazole. So the route of administration is through the oral cavity, through mouths and the intravenous injection. So the dosage in general adults, it should be 750 mg 3 times per day for 5 days only. So in children's or in children's it should be 15 mg per kg per day in 3 doses for 5 days only. So there are some side effects of these drugs, such as potential mutagenicity, in cause mutation in the body, and that metallic tests will get in the mouth. So the other side effects such as nausea, dizziness, and headache will shown by the patient when we administered these drugs to that patient of giardiasis. So another drug is nitrazole. nitazoxanide. So the nitazoxanide is the route of administration is also through the oral and intravenous routes. So the dosage should be 500 mg twice daily for 3 days, or it should be 100 to 200 mg as per the day depending on the age for 3 days in child or in adults. So the side effect of these drugs is abdominal pain or constipation will happen to that patient when we administer this drug nitazoxanide. So yellow discoloration of urine and dry mouth and dizziness are some side effects which we will see in the patient when we administer this drug. So the mechanism of action in metronidazole. So there is a general pathway of glycolysis to convert into pyruvate glucose to carbonate glycolysis, and these reduction, pyruvate ferredoxin oxidoreductase, which helps in reduction of coacetal A to acetyl CoA, which gives us acetate and ethanol, or it will help in ferredoxin oxidized ferredoxin into a reduced ferredoxin. So this PFOR helps in the metronidazole to reduce into nitrose and hydroxylamine radicals. So these are some cytotoxic, these become some cytotoxic substance, and generally it affect the DNA of the organism, of the infected protozoan of the Giardia lambda. So it directly infect bond or attach with the nucleotides of the parasite, and it destroy it slowly through that cytotoxic substances. So the mechanism, both the mechanism of both the drugs are same, like nitazoxanide and metronidazole have both affect the DNA, directly binds to the nucleotides and destroy it through the nitrogenous free radicals. So there are some other alternative treatments for this giardiasis or these diseases. So we can take some example of drugs. These are alternative drugs such as paranomycins. The dosage should be this much, 25 to 35 mg per kg, but thrice a day. It generally inhibits the mechanism of action. What it does is it generally inhibit the protein synthesis of that flagellated protozoans. So there are some side effects which we shown is nephrotoxicity with systemic administration during pregnancy. So another drug is pyrazolidine, which should be administered with 100 mg 4 times daily for 7 to 10 days. So what it does is it is related to another drug, like it create another free radicals or free product and believe it to be binds with the DNA and destroy it, and by making a cross linking between the DNA nucleotides. So some of the side effect or symptoms will show this nausea, vomiting, diarrhea. These are some side effects shown by these drugs. The another one is quinocrine, which gives 100 mg thrice. This is the dosage, and the mechanism of action is unknown. So the side effect is bitter taste, vomiting, yellow orange discoloration of skin and urine. So other side effect include such as nausea, vomiting, headache. These are just normal side effect of these drugs. The another drug which we are talking about is albendazole, which is an alternative drug to treat these flagellated protozoans. So the dosage should be 400 mg once for 5 days, or 15 mg per kg once for 5 to 7 days in children, and 400 mg once for 5 days in adults. So generally the mode of action is it generally inhibit the assembly of microtubules during the cell division. So some side effects are anorexia and constipation. These are just normal side effect of this drug albendazole, and some other rare side effects which include reversible neutropenia and elevate liver function test. So another drug is mobendazoles, and the dosage should be 200 to 400 mg. So the mechanism of action, or what this drug does to the flagellated protozoan, is it also inhibit the microtubule assembly, and the side effect of these drugs is same of the albendazole, such as constipation, anorexia, and all this. So another parasite we were talking about the flagellated protozoan. Now coming to the ciliated protozoan. So one of the example of ciliated protozoan is Blenterium coli. So Blenterium coli is a parasitic species of ciliated protozoans, which is responsible for the disease Blenteriasis. So it causes a disease, and it is the causative agent of a disease called Blenteriasis. So it is the largest known protozoan, and these are only ciliated protozoans which have cilia in as their locomotory organ, known to human, parasitize human, which is the parasite of human. So the life cycle of this ciliated protozoan Blenterium coli is, it infect the stomach and small intestine. In fact, not the stomach but the small intestine, the cyst in the infected stage, and the acquired by the contaminated food and ingestion, or taking of contaminated food and water. So it affects the small intestine, and the cyst is produced. The cyst converted into the trophozoite until the stage 4-5, it remains inactive stage. So after that it get activated into the small intestine. It make a number of copies of them and causes the disease Blenteriasis. So drug of the choice for this is the one drug is tetracycline, which generally inhibit the protein synthesis. Tetracycline inhibit the initiation amino acid, like amino acid tRNA synthesis, when bring back the amino acid into the small subunit of ribosomes, it inhibit there. So the route of administration of this drug is orally or intramuscular or intravenous injection. So the dosage is 500 mg 4 times a day for 10 days in adults, and in children's which is less than 8-year-old should give 40 mg per kg per day in 4-day doses for 10 days. So maximum 2 gram per day should be given to the children. So some side effect of this drug is the stomach cramps, diarrhea, skin rashes to sunlight or skin reaction to sunlight, and fever are some common side effect. Some serious side effects such as blurred vision, unusual headache, and watery diarrhea are the rare symptoms or serious side effect of these drugs. So generally tetracycline inhibits the protein synthesis. It is an antibiotic which inhibit the binding of amino acid tRNA to the mRNA ribosome complex. Here it inhibit this, the tetracycline inhibit the it's an antibiotics which inhibit the protein synthesis by inhibiting the binding of amino acid tRNA to the mRNA ribosome complex. So some other alternative drugs are iodoquinine. So dosage should be given 650 mg thrice daily for 20 days. In children's, it's 40 mg per kg per day in 3 doses for 20 days. So the mode of action of these drugs is, the mechanism or the mode of action is still unknown. The side effect of these drugs are seen as headaches, nausea, vomiting, optic nerve damage, and peripheral and neuropathic reports in individual is reported in individual when we give exceed amount of these drugs which we do which was recommended by the physician, and we give exceed by not listening to the recommendation. So another drug is metronidazole, which the dosage should be 750 mg thrice daily for 5 days. In children, in adults or in children, we should give 35 to 50 mg per kg per day in 3 days, 3 doses for 5 days. So the general mechanism or mode of action of this drug is non-enzymatically reduced by reacting with reduced ferredoxin, PFOR, as I already said, pyruvate ferredoxin oxidoreductase, and deactivate many other enzymes. So some serious side effect which has been seen by this drug as mutagenicity, metallic taste in mouth, nausea, dizziness, and headache are some of the side effect of these drugs. You can go through, these are some references. You can go through these books, KD Chatterjee parasitology, or through these things you can study more about the drugs for parasitic protozoans. So thank you for watching the video. If you like it or if you think that it is good, then like, share and subscribe.